Hello and welcome to Pregnancy Info. If you are a female and you are pregnant, then you have to understand the causes of C-section. Do you know what is a C-section? A C-section, also called a cesarean section or cesarean delivery, is a surgical procedure in which a baby is delivered through incisions in your abdomen and uterus. They are performed when a vaginal delivery is not possible or safe, or when the health of you or your baby is at risk. Here are some reasons for a cesarean birth. Healthcare providers may have many reasons for recommending cesarean birth. Some cesareans occur in critical conditions, some are used to prevent critical situations, and some are elective. What are the reasons for cesarean deliveries? A cesarean delivery is a birth that occurs through an incision in the abdominal wall and uterus rather than through the vagina. The first cause can be placenta previa. This occurs when the placenta lies low in the uterus and partially or completely covers the cervix. 1 in every 200 pregnant women will experience placenta previa during the third trimester. Treatment involves bed rest and frequent monitoring. If a complete or partial placenta previa have been diagnosed, a cesarean is usually necessary. If a marginal placenta previa has been diagnosed, a vaginal delivery may be an option. Placental abruption. This is the separation of the placenta from the uterine lining that usually occurs in the third trimester. Approximately 1% of pregnant women will experience placental abruption. Their mother will experience bleeding from the site of the separation and pain in the uterus. This separation can interfere with oxygen getting to the baby, and depending on the severity, an emergency cesarean may be performed. Uterine rupture. In approximately 1 in every 1500 births, the uterus tears during pregnancy or labor. This can lead to hemorrhaging in the mother and interfere with the baby's oxygen supply. This is a reason for immediate cesarean. Breech position. When a baby is in the breech position, a cesarean delivery is often the only option, although a vaginal delivery can be done under certain circumstances. However, if the baby is in the distress or has cord prolapse, a cesarean is necessary. A cesarean may also be done if the baby is premature. Cord prolapse. This situation doesn't occur often, but when it does, an emergency cesarean is performed. A cord prolapse occurs when the umbilical cord slips through the cervix and protrudes from the vagina before the baby is born. When the uterus contracts, it causes pressure on the umbilical cord, which diminishes the blood flow to the baby. Fetal distress. The most common cause of fetal distress is a lack of adequate amounts of oxygen delivered to the baby. If fetal monitoring detects a problem with the amount of oxygen that your baby is receiving, an emergency cesarean may be performed. Failure to progress in labor. This can occur when the cervix has not dilated completely, labor has slowed or stopped, or the baby is not in an optimal delivery position. This can be diagnosed correctly once the woman is in the second phase of labor. Repeat cesarean. 90% of women who have had a cesarean are candidates for a vaginal birth after cesarean for their next birth or VBAC. The biggest risk involved in a VBAC is uterine rupture, which happens in 0.2 to 1.5% of VBAC. However, there are a criteria you must meet in order to have a VBAC. Consult with your healthcare provider about your current situations and your options. Cephalopelvic disproportion. A true diagnosis of CPD occurs when a baby's head is too large or a mother's pelvis is too small to allow the baby to pass through. Active genital herpes. If the mother has an active outbreak of genital herpes, a cesarean may be scheduled to prevent the baby from being exposed to the virus while passing through the birth canal. Diabetes. If you develop gestational diabetes or you are diabetic during the pregnancy, you may have a large baby or other complications. This increases your chance of having a cesarean. Preeclampsia. Preeclampsia is a condition involving high blood pressure during pregnancy. This condition could prevent the placenta from getting the proper amount of blood needed and decrease oxygen flow to the baby. Delivery is sometimes recommended as a treatment for this condition. Only with severe preeclampsia is a cesarean needed. related. Birth defects. If a baby has been diagnosed with birth defect, a cesarean may be done to help reduce any further complications during delivery. Multiple births. Twins may be delivered vaginally depending on their positions, estimated weights, and gestational age. Multiples of 3 or more are less likely to be delivered vaginally. Transverse lie. The baby is in a horizontal or sideways position in your uterus that can be the cause of cesarean. Health conditions. Conditions like heart disease could worsen with labor during a vaginal birth. Obstruction. A large uterine fibroid, a pelvic fracture, or you are expecting a baby with certain congenital anomalies may also be a reason for a C-section. Contractions are too weak. This is one of the common cause of C-section because the baby is too weak to be delivered or baby isn't tolerating labor. HIV infection in the mother. If the mother is suffering the HIV infection, is one of the cause of C-section delivery. Another reason is your own decision. If you want a painless or C-section delivery, this is another reason of C-section delivery. So these are the maximum causes of C-section delivery. You have to understand and be alert and be aware of your condition. Take care and share this video with the other pregnant women who are expecting. Thank you.